Hi everyone, I'm Mitch, an RN pursuing advanced practice in Missouri. Today I'm breaking down the APRN scope of practice here in the Show Me State, how far it really lets APRNs practice, what barriers still exist in a straightforward strategy to get to full practice authority. First, how much freedom do APRNs actually have to practice independently? Missouri is still a restricted practice state, which means APRNs have to work under a collaborative practice agreement, also known as a CPA, with a physician. That agreement outlines what we can diagnose, treat, prescribe, and it also comes with strings attached. We're required to have chart reviews. About 10% of all encounters, more of controlled substances are involved, and those reviews have to happen every couple of weeks. There's also an initial month of side-by-side supervision required before an APRN can work more independently or without a physician on site. Each physician can only collaborate with a handful of advanced practice registered nurses, which makes finding one tough in rural areas. While some old rules like the 75-mile limit have been relaxed, we still don't have true autonomy. There is still a distance restriction in place. In short, APRNs can practice, but not to the full extent of our education and training. Next, let's discuss the barriers that keep us from practicing fully. At the state level, that same CPA system is the biggest hurdle. It limits prescriptive authority, especially for Schedule II drugs, creates extra paperwork, and can be expensive. In rural Missouri, it can even stop an advanced practice nurse from serving a community altogether if there's no collaborating physician nearby. On the federal side, Medicare and other payers do reimburse APRNs, but at lower rates than physicians, and some policies still require physician sign-offs. That patchwork of rules adds cost, and it also slows down care. So, how do we fix it? I like to think of it in three different steps: the legislative step, the regulatory step, and the payer step. In the legislative step, Missouri needs to move toward full practice authority, like many other states have already done. Even a phased model would help, where after a set number of supervised hours, APRNs could earn full independence. In the regulatory step, our nursing board could also help simplify things by removing leftover distance limits, cut unnecessary paperwork, and replace quota-based chart reviews with quality-based metrics such as patient safety or patient satisfaction. And the payer lane, we need fair reimbursement. APRNs should be paid at parity and recognized as primary care providers, just as any other primary care provider would be. When all three lanes or steps line up, everyone wins. Access improves, wait times drop, and rural communities get the care they need. Other states have proven that it works, and Missouri can do the same as well. I'm Mitch. Thanks for listening. If you live in Missouri, reach out to your legislators and tell them to support full practice authority for advanced practice registered nurses. Access delayed is care denied.